Now to a health alert and an eye-opening new study about preterm births. The March of Dimes gave the U.S. a D+ in its annual preterm birth report card.
And New York and New Jersey's preterm birth grade was a C+. Connecticut, a C.
The report also finds the racial disparity in preterm births is worsening. Dr. Darien Sutton is here now to talk much more about this. This is really concerning.
It is terrifying. You know, the United States ranks one of the most dangerous places to have a baby when you're comparing to other high-income countries based on this report. Not only are infant mortality rates exceeding the numbers that we would expect and hope for, but maternal mortality rates are also some of the highest when you compare to other countries. It shares with us as physicians and also public health advocates something needs to be done as soon as possible.
So how do you bridge the gap with the racial disparity?
You know, when you're looking at the racial disparity, and that's another important concerning statistic, Black mothers are 2 to 3 times more likely to die from their pregnancy and during their postpartum period. We have to look at the low-hanging fruit. When you look at the map of the United States, these rates and risks are not the same in every state, and we have to look at the policies that influence these outcomes. For example, in states that have decreased Medicaid coverage and decreased Medicaid access, we see increases in the risks related to women. When states have reduced access to care, maternal mortality deserts, these are counties that have no OB in them. In states like Mississippi, which have some of the highest rates of maternal mortality, more than 50% of their counties do not have an OB provider. And as you guys know, visiting the OB can be 10, 12, 15 times during your pregnancy. Making that commute hours long can increase harm on the mother and risk on the family. So talking about these specific things that can change in policy that produce outcomes, I think is where we should focus.
Yeah, we need to shed a lot of light on that issue, no question.
Absolutely.
It's mind-boggling that we're talking about.
Yeah, it really is in this day and age. You know, another topic we want to discuss. This morning, the president of Novo Nordisk made a major announcement at Good Morning America. Take a listen before I ask you the question.
For self-paying patients, starting today, patients can access Wegovy and Ozempic for $199 a month for the first few months, and then it moves to $349 a month.
So what do you think? How big of a deal is this?
I think that's a huge deal. You know, there are more than 100 million Americans that are either overweight or obese, and looking for these medications, when you're looking at the access, it is difficult and the demand is high. More and more people are looking for these medications. The important point here is that they have to be regulated, they have to be surveilled. You can't just take these types of medications without being monitored by a physician. So important to understand, they are meant to be used in conjunction with physical activity and diet changes, and there are wonderful medications that can help many people, but you need to be able to understand the risks, getting monitored on a regular basis and making sure you're talking to a provider to make sure that the dose and the amount and the brand is right for you.
All right.
Very important, because people think it's just like an easy fix.
Yeah.
It really is much more to that.
And exactly, and we see that when you stop these medications, just as much as we've learned about obesity, it is a chronic relapsing condition, and so you have to understand that weight gain typically happens because of that reason. So reframing how we look at this diagnosis is also an important point of this.
All right, Darien, thank you.
Of course.
Appreciate it.